Lyme disease and its prevention, presented by Terry Lauren, Industrial Hygiene Consultant. What is Lyme disease? Lyme disease is an illness caused by the spirochete bacterias Borrelia burgdorferi and Borrelia mayonnaise in the state of Wisconsin. It is spread to humans by the bite of an infected deer tick, also known as the black-legged tick, and/or the scientific name of Isodes scapularis. First symptoms include fevers, chills, various rashes, headache, fatigue, muscle and joint ache, and swollen lymph nodes may occur in the absence of rash. Later signs and symptoms include severe headache and neck stiffness, facial palsy, arthritis with severe joint pain and swelling, heart palpitations or irregular heartbeat, episodes of dizziness, shortness of breath, nerve pain, shooting pains, numbness or tingling, inflammation of the brain and spinal cord. The deer tick, the black-legged tick, otherwise known as the deer tick, can be hatched, born with the infection, so the larva, nymph, and adult can spread the disease. Otherwise, they are spread by a reservoir animal to the tick and then to another blood meal animal. The adult tick is very small and is the size of a flake of pepper or a pinhead, and the other life stages are even smaller. Deer ticks live in woody, brushy areas that provide food and cover for hosts such as mice and deer. Exposure to these ticks can be greatest along trails and edges of woods. Ticks search for a host from the tips of low-growing vegetation, generally climbing onto a person or animal near ground level. They are stimulated by heat, carbon dioxide, and movement. Without snow cover, adult ticks can be active in temperatures as low as 28 degrees Fahrenheit. Other relevant information. The official CDC view of how long it takes a tick attachment to cause infection is 36 hours or more, but there is research that indicated 6-hour attachment of an infected tick will cause infection. Laboratory testing is the only way to confirm Lyme disease as the diagnosis. It is prudent to perform tick check after walking in a tick habitat area. Shower soon after being outdoors in a tick habitat area to reduce the chance of tick attachment or to dislodge ticks. Examine clothes for tick and place potential tick-infested clothes in the clothes dryer under high heat for at least 10 minutes. If these clothes need to be washed, wash with water hot and place in the clothes dryer with the high heat setting. Bug repellents. For bug repellents for clothes, the preferred chemical is 0.5% permethrin containing products which should not be sprayed on skin. For human skin, 30 to 40% DEET containing bug spray is most effective for ticks and can be used on clothes as well. Other advisable bug sprays containing picaridin, IR3535, oil of lemon eucalyptus or OEL, paramethane diol or PMD, or 2-undecanone are useful also. Do not use products containing OEL or PMD on children under 3 years old. Treatment for the most common form of Lyme disease. The antibiotics that are in use are doxycycline, with adult dosage of 100 milligrams twice per day orally for 10 to 14 days. Children, 4.4 milligrams per kilogram per day orally, divided into 2 doses for 10 to 14 days. Amoxicillin. The adult dose is 500 milligrams 3 times per day orally for 14 days. Children, 50 milligrams per kilogram per day orally, divided into 3 doses for 14 days. Cefuroximine, adult dose is 500 milligrams twice a day orally for 14 days. For children, it is 30 milligrams per kilogram per day orally, divided into 2 doses for 14 days. Sources of information on the internet. The CDC, of course, as you see, cdc.gov/Lyme. There is an organization about Lyme's disease, and it's lymedisease.org. The Wisconsin DHS has a site at dhswisconsin.gov/tick/Lyme. The National Institute of Health has a site, and the country of Canada has safety data sheets on organisms. And here is the one for the Borrelia organism that causes most Lyme disease in the US.